So what do we do with surgery? So the two most common things that we'll do surgically is address the nose. So we'll do a rhinoplasty. So we'll give them a nose job. And what that does is that allows us to open up those nostrils to a more normal position. Again, we won't have a nose that looks like a Labrador, but we'll have an open nostril so that we can move air in and out. The way that I like to think about this is if you put your finger on the end of a straw, so you have a narrowed airway like a straw, you put your finger on the end and the airway is going to collapse, or that straw is going to collapse around as you suck in air. If that happens in your airway, that's a critical situation, and that can lead to those advanced signs of this condition. So we want to correct that. So we open it up, we take our finger off the straw, we open up those nostrils, and then we can have a much better breathing apparatus there. The second most common thing that we'll do is we'll do a soft palate resection. So a soft palate resection means that we'll go actually into the back of the mouth and we'll cut that redundant tissue away. Then we'll oversew it so that it is a nice incision that will heal back together. And once it heals back together in this more normal position, then that airway will be open because we won't have that draping effect where that soft palate will actually drape into that airway. The other things that we will do is we'll assess that voice box. So that voice box can have some secondary ramifications of this condition, like we talked about with the straw effect. One of those structures that can collapse down, what we call laryngeal collapse, is the larynx. So if we are breathing against a closed circuit and we're breathing in really hard, we can start to get laryngeal collapse. If we have laryngeal collapse, which the most common kind of low grade of this is what we call saccular eversion. So these little proliferations of tissue will kind of pop out into the airway. If that's the case, we'll just take those saccules out, which we call a sacculectomy. If there's true laryngeal collapse, where we have more advanced grades of cartilage weakening and collapsing down of that airway, that is a really serious condition and can lead to major complications. So that's something that we're going to want to assess as we're looking into your dog's throat to make sure that that's not the condition we're dealing with.